See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association, and hosted by nurse economist and health tech specialist, Shauna Butler.
Social conditions play a huge role in our well-being.
Communities really know what's going on, and we as researchers should listen to the communities.
I'm Latino. I grew up in the South Bronx. I have parents who are both immigrants, one from Puerto Rico, one from the Dominican Republic.
I'm from El Salvador. I immigrated to the United States when I was 4 years old with my mom.
For me, what the Institute for Policy Solutions is about is the integration of this deep commitment to social welfare and social justice, to public health and thinking about communities and families and people in broader contexts, and nursing.
I'm hopeful that some of the research that we're doing will influence policy, will influence growers, to really start working together to stop workers from getting sick.
Welcome to a special episode of See You Now. I'm Shauna Butler.
Bienvenidos al show See You Now.
As a podcast focused on how nurse-led innovation is strengthening our healthcare systems, advancing health equity, and transforming lives, we're taking this opportunity to celebrate Hispanic Heritage Month and lift up the 2024 theme, Pioneers of Change, Shaping the Future Together.
Feliz mes de la Herencia Hispana.
This annual observance celebrates the achievements, histories, traditions, diversity, and vibrant culture of Hispanic and Latino Americans whose heritage is rooted in Spain and 21 countries and territories that include
México, Guatemala, Honduras, El Salvador, Nicaragua, Costa Rica, Panamá, Colombia, Venezuela, Ecuador, Perú, Bolivia, Paraguay, Chile, Argentina, Uruguay, Cuba, Puerto Rico, Guinea Ecuatorial y la República Dominicana.
In heeding the call set forth by a White House proclamation to acknowledge and amplify the impact Hispanic peoples have had on our nation, See You Now is sharing a sampler highlighting the scholarship, leadership, and contribution of two contemporary Hispanic nurses who exemplify the Pioneers of Change theme. We open our sampler with an excerpt from episode 89, Taking Care, Nursing's Power to Change Our World, where we meet bilingual, bicultural nurse researcher Roxana Chicas. Roxana is an assistant professor at the Woodruff School of Nursing at Emory University in Atlanta, Georgia, and an investigator on some extraordinary community-based research that she does in collaboration with the Farm Worker Association of Florida. Increasingly, we're hearing and feeling the effects of extreme heat, and no one knows this better than farm workers. Roxana is working directly with the community of farm workers in Florida to find out how the heat is impacting their health and what's needed to help them stay safe. She opens her story by sharing some of her background and what has shaped her career and her research interests.
I'm from El Salvador. I immigrated to the United States when I was 4 years old with my mom. I was undocumented until I was 18 years old. And then I got temporary protected status, which gave me the ability to have a social security number and to be able to work. So I understand what it feels to be undocumented and to want to work and not really cause any trouble. The goal, my mom would always tell me, was get a job, get a good job so that you always have a job and your boss always loves you, right? And keeps you working. A lot of agricultural workers, that is their goal. They want to be employed because they want to provide for their families. And that's why they take on these very harsh jobs that are low wages, because oftentimes that's the only thing that they have access to. And so I felt that, I had the opportunity to study here because of great mentors who kind of guided me into higher education. And I thought that it was important that I give back to my community, that I was giving this platform where I could perhaps influence policy or how research is done. And As a nurse, researcher, we can be out there in the community and do a lot of the biological collection. We can also give health education and do science. So my research really is with agricultural workers, looking to see how heat affects their health. And we do this with the Farm Workers Association of Florida, because I think that anytime you do community engaged work, the gold standard should be that you should partner with an organization who has built a rapport with the community, has their trust, and also their best interests, who can direct us researchers in, making sure that we are doing ethical research that's not burdensome to the community and that it's really meaningful to the community. And so, for example, when we were thinking about doing research in Florida with agricultural workers, we thought that we were going to do research on pesticides. And it turned out that the community was not interested in pesticides. And this was back like 12 years ago. They were interested in how heat was affecting their health because they were exposed to the heat and they felt different. Like they could feel that the heat was increasing. And they said to us, it has to impact us. How is it impacting us? Communities really know what's going on. And we as researchers should listen to the communities to find out what it is that they're worried about so that we can provide meaningful results in the research that we do. And so that was 12 years ago, and we're still researching what heat does, but we're also trying to balance finding ways to protect workers from heat-related illness symptoms. So we feel that we can do both at the same time, right? We can investigate what's happening, but also find ways to protect workers. And this notion that that's just the way the environment is, this is just hard work, it's harsh work, and you have to accept it, is not true. We can protect workers. There are ways to do it, and hopefully to get growers to embrace methods to protect workers and also to influence policies. There aren't any federal heat protection standards for outdoor workers. And with climate change and the intensity of heat waves, it's becoming more and more of a problem. So I'm hopeful that some of the research that we're doing will influence policy, will influence growers, to really start working together to stop workers from getting sick, to protect these workers, because all of us benefit from their labor every single day that we eat. And it's important that we start taking care of them. There's a lot of things that nurses do to protect different communities.
From episode 102, Healthier Policies for Healthier People.
Hi, I'm Vincent Guilamo-Ramos. I am the Executive Director of the Institute for Policy Solutions at the Johns Hopkins School of Nursing. I also am an Aspen Health Innovators Fellow, and I'm also a graduate of the 2016 class of the Presidential Leadership Scholars Program, and I'm very much honored to serve as the co-chair of the Health and Human Services Presidential Advisory Committee on HIV and AIDS. I am trained as a nurse, in particular as a nurse practitioner who specializes in primary care and psychiatric mental health nursing. I'm Latino. I grew up in the South Bronx. I have parents who are both immigrants, one from Puerto Rico, one from the Dominican Republic. And I grew up in a neighborhood where almost everybody was Latino or African American. And I didn't realize at the time that there were communities that were not that far from where I lived, where life was very, very different. It was amazing in many ways. I had a strong sense of my cultural identity, who I am, my community, strong roots. And I also realized, Shauna, that when I traveled to places like Manhattan, I would sort of look out the window of public school buses and I would say, on the way to that museum trip or wherever we were going, was typically part of school, that life looked different, that people's experiences, their homes, the streets, the kinds of stores, how they dressed, things just looked different. They looked a lot nicer than where I was coming from. And as a child and as a person who was growing up, I wanted to have some of that experience. And I felt perplexed by, well, why didn't things look quite that way in my own neighborhood? And, as I got older, I started to understand that so much of what really shapes what happens to us is the community where we're born, where we live, where we grow up, where we work, and that social conditions play a huge role in our well-being. I am a proud nurse today, but I didn't start off as a nurse. I started off as a social worker, working on issues related to why do people fall through certain cracks in our society's fabric and wind up in tough situations. And then how do I prevent, or how do we as a country prevent people from experiencing really difficult circumstances like poverty? That led me to public health, thinking about how communities could come together and we could leverage community solutions that really engage the people that live in a particular geography, a particular neighborhood, and how they could play a role in what happens in their lives. All along the way, I had this nagging feeling that I really wanted to provide direct care. I knew that I was committed to prevention. I was committed to health promotion. And when people do, in fact, get sick or develop a condition, I wanted to help them to get better. And that led to nursing. And for me, what the Institute for Policy Solutions is about is the integration of this deep commitment to social welfare and social justice, to public health and thinking about communities and families and people in broader contexts, and nursing, which brings together whole person-centered care. Those three things are what have led me to this new opportunity that I'm super excited about, and the chance for being able to shape policy and how we create a context where we can improve health for everyone, for every single person and community in our country. One of the things that I would like to share is really the mission of the Institute for Policy Solutions, which is to redesign health, to move health into much more prevention, much more health promotion, and when people do get sick, really restoring them to their optimal health versus a workforce that is primarily being trained to care for people once they get sick. One of the things about the Institute for Policy Solutions that is so unique and that really makes it different than other kinds of health policy research centers or institutes or initiatives is that it draws upon the wisdom and the experience, the expertise of the nursing workforce. It's really important to me that we lead with redesigning health and that we are committed to improving the health of every single person in our country, recognizing that nurses play an important role and that we need, as a society, to fully embrace the full workforce, including the largest segment, nurses. And so if you think about our country and why this is such an important moment, the fact that the majority of adults in the United States have one or more chronic conditions. If you project out into the future, what we look like as an overall population, that basic trend is going in the wrong direction. It's getting worse. Our life expectancy is going down. People typically talk about COVID and the opioid epidemic as being major drivers of the reductions in life expectancy. That's true, but actually some really interesting research came out in the American Journal of Public Health. And I would hope that folks, as they're listening, can really hear the urgency in what I'm trying to communicate. That life expectancy, it didn't just start to go down because of COVID and the opioid epidemic. Really, since the 1950s, there's been evidence that life expectancy across the globe in many geographies has been going up, and that our life expectancy in the U.S. has been going in the wrong direction. We have been showing, particularly in certain segments of the population, certain geographic spaces, life expectancy, for example, in Mississippi is actually today less than it is in Bangladesh. And that kind of difference, it's not acceptable for the United States. When we look at geographies where there's a lot of economic disadvantage, where there's lack of employment opportunities, where people are struggling with food insecurity, where they may not have transportation, and I wish that more people would see those things as being connected. You know, as I sit back and think about our country across many areas, whether it be mental health, depression, anxiety, migration, sexual and reproductive health, certainly what's happening with syphilis and really the spike in congenital syphilis, and it's very geographically concentrated, tells you context matters. I think that the growing percent of our income being spent on our healthcare needs because it's getting more and more expensive to buy whatever the medications are, or to see certain kinds of providers, being able to actually identify a specialist if you need a specialist and getting on that appointment list. And I'm being very intentional because it is oftentimes a list and a long delay of getting that appointment that is so important to preserving our health and addressing our concerns. I mean, these are all things, Shona, that I think every single person in our country is thinking about and asking a tough question. How do we come up with solutions that will really change the policy landscape so that our entire country can have a more healthy, more positive, more optimistic future?
During Hispanic Heritage Month, we invite you to learn from, follow, engage, and cite Hispanic nurses and their groundbreaking work and contributions to moving health equity forward. You can find links to the full episodes featured in this sampler in our show notes, along with several resources to dive deeper into the culture, history, and contributions of Hispanic nurses. Gracias to Joy Diaz, who assisted us in our celebration of Hispanic heritage. For See You Now, I'm Shauna Butler. Thanks for listening.
Nurses are transforming healthcare through innovation, compassion, and leadership. And Johnson & Johnson is proud to continue its 125-year commitment to champion nurses through recognition, skill building, leadership development, and more. The American Nurses Association is dedicated to building a culture of innovation. Nurses improve the lives of patients and communities through innovative thinking, empathetic connection, scientific rigor, and sheer determination. ANA is proud to support and advocate for our nation's most valuable healthcare resource, our nurses. For more information on See You Now and to listen to any of the earlier episodes in our library, visit seeyounowpodcast.com.